This is Sonia Wagner representing PCA families in one of our recordings that capture lived experience and best practice research-based learning that assists kinship, permanent and adoptive parents and carers in supporting young people. PCA Families has a zero tolerance of child abuse. I'd like to acknowledge the traditional custodians of the land on which we meet and pay respect to elders past and present and express our intention to move together to a place of justice and partnership. Today we are discussing therapists with Dani Lucas. Dani is a program coordinator for Relationships Australia Victoria and was previously the team leader of permanent care and adoptive families. Dani is a skilled trauma-informed specialist with a Bachelor of Psychological Science and postgrad qualifications in complex trauma, family violence and therapeutic intervention. Dani is passionate about the sector and the delivery of services to families and children. Welcome, Dani. What else do we need to know about you?
Thank you for having me, Sonia.
You're welcome.
Yeah, I do have a very long-standing passion for working with children, families and individuals that have a history of trauma. My journey has started way back in child protection in the early 1990s, and in a professional capacity, I've worked on a range of programs with families, young people. And then in a personal perspective, I've also gone on to experience some of that journey myself. Through those, in both professional and in a personal aspect, we've had to navigate working with a myriad of therapists and professionals along the way, which can be a very tricky minefield to juggle through. I've got two children of my own, one who came into our family through the biological way and one through the inter-country adoption process. So through both of them, we've had to seek therapists, and it can be really, really daunting, and going through the uniqueness of your needs and your children's needs, particularly on an ongoing basis, can just be a challenge, but very worthwhile, and it's really worth it to get those correct professionals for you and your family.
Absolutely. So, and hopefully we'll help with some of those questions today. So, so I guess, you know, you did mention there are so many different types of therapists and specialists. So knowing whether it's a speech pathologist or a tutor, or maybe a sensory specialist or a psychologist, play therapist, psychotherapist, like it's kind of mind-boggling. How do you work that out? What's the first step?
I suppose it's really it is complex, like you say, and the first step is to really look at your child, the age of your child, and what's the most pressing need. I mean, it's really, really it comes as our first priority when we have children, is to want to fix their problems and to address those needs. And you really need to not overwhelm your child. So sometimes they can need a multitude of interventions across the space of their maybe 6, 10, 15 years. So it's really important to try and work out what's the most important area to focus on first. And then also factoring in things like cost. I mean, there's assessments that are expensive, there's the actual therapies that are expensive. And you'll often find, if you try and even for yourself, write down and see what's the most the thing that comes to mind the most that your child's struggling with, that you feel that they would help with, and then try and explore with that. A good discussion point is with a good paediatrician, a good GP, and even a more well-rounded advocacy program like PCA Families, or more family counselling can even point you in a lot of those directions and identify where's a good place to start and what you should target first with your child. I suppose when you're looking at psychology, counselling, psychotherapy, all those types of things, you really need to factor in the age of the children, because we could start with, a lot of people will jump to think talking therapies can be best, but with a younger child, definitely starting with some of those play therapies, art therapies that you might be not thoroughly convinced are going to work, or what's coming out of this is often a very good place to start. You'll find that you may get recommendations to completely out there type of things. What might think, why are they therapeutic? Yoga, surfing lessons, mind-body type activities. But for some children, that's the first step of starting to identify different parts and senses in their body. So yeah, it's just really good to look at what's out there, explore your options, and discuss it with preferably firstly a paediatrician or a GP.
Okay, and so it sounds like being open to ideas and suggestions and
Yeah,
alternatives. So yeah, so okay.
and I
And
mean,
where
it's
do you go to find those professionals? Is it about tapping into your network and getting word of mouth, or is it getting online? How do you go about doing that?
I mean, you could really say all three, but it is about, I suppose, compiling a bit of a list. It will depend on where you live, and if you're, if you're more rural, or you have the accessibility to the city, where there will be a few more options. But certainly looking at some of those keywords on people's online web pages, then following it up with a phone call, just trying to really understand if they are more in depth in the trauma space that a lot of our families and children will be coming from. There's a lot of psychologists who work with generalized trauma, and when you sort of dig that bit deeper and maybe give them a call, they'll sort of really say, oh no, I've never worked with families made up in a bit of uniqueness. I know, coming from being an adoptive parent, it took me a long time to find a paediatrician even who'd ever worked with another child who was an intercountry adoption.
Yeah.
So it can be a lot of legwork to get to that person, and certainly online groups. I know PCA families do have a talk session and get other parents together, and they can be a great resource, because you'll get a lot of information of what people have tried and who's worked, and also don't be discouraged if you do get a recommendation and it doesn't work for your child, because you may have that just may not click or get that rapport going, and that's still perfectly okay, and it doesn't mean that your child won't need speech therapy. They just might not click with that particular speech therapist. We've had a similar experience with our second speech therapist when we moved states, and it just wasn't the right fit. So it's sometimes it can be, unfortunately, a bit of trial and error.
Yeah, I think that's really important, finding that right fit. So in my experience, so how do you start that conversation with the therapist? It's often difficult for our carers to know how to start, because often there is so much kind of content that you could be sharing. So
and it's really hard to tell your child's story over and over again sometimes to therapists, but you may have to be that person that does that journey. And I got a really good recommendation once from an NDIS provider, and you just really have to try and put yourself as if you're watching a bit of a movie when you tell the story, and try and detach a little bit, because you have to give the facts, and sort of making sure that the person is particularly trauma informed is really important. But giving that background, that context, and that content of your child's story is also really important. You'll sort of even get that feedback, even if it's just verbally or facially, from the therapist, if they know where you're coming from or where your child's coming from. And sometimes it won't come across as the best person that you pull out of the hat that looks like they meet all the goals. Sometimes there's just someone that might have a similar passion. They might have all that skill set and just really want to go down that journey with you. And sometimes they can be the best advocate for yourself and your child as well. I think it's also really important to set up mutual goals quite early in the piece.
Okay.
And it's not problematic to keep coming back to them, or having, I suppose a lot of people feel fearful, especially if they've been on a wait list or something, I don't want to offend the therapist, or I don't want to do this, but it's your child's journey, and they're not going to get the best out of it if you can't have that kind of relationship with the therapist.
Yeah, absolutely. And I guess that's it too, isn't it? Like you mentioned, I mean, sometimes we're waiting 9-12 months for somebody, so maybe it is, if someone's willing to be trauma informed, to take a chance on someone else, so that you think might fit. So
and sometimes you will be providing them, you can sometimes provide them with added resources around context. They'll obviously know their profession, but you can be giving them some of that sort of that background. And I think it's always really important to establish those guidelines and what your expectations are, and if they can meet them, before you commit to any sort of long-standing relationship.
Yeah. So how do you build the relationship, and what should you expect as a caregiver in terms of that contact with a therapist? I guess being informed about what's going on with your child.
So, I think it's really important to set up those guidelines and those expectations from the very beginning. It's a mutual type process, and there will be, depending on the age of your child, and if it's a psychologist or speech pathologist or OT, there will be some of that confidentiality exploration, particularly if it's a child entering into early teens. They might ask the child's consent about certain information. They will always share with you if there's any safety concerns, obviously, but that's more around a psychologist. Working with speech pathologists and OTs, you would set up what works, what's the feedback? Am I in sessions? Am I not in sessions? Does that work? Does that work for you? I'd sort of really make sure that's quite clear before you start them, start the engagement with the therapist, and then also regular check-ins and seeing where it's going, how it's going. I think it's realistic. You have to set realistic expectations. We all want, our children to get the best, and we want to see some kind of change, but to be realistically, sometimes some interventions can take, a number of months or years. I mean, I will say months, but it can expand to years before you're really getting that ongoing work to see that outcome. And I mean, it's really important not to be discouraged. But that fine line, pause or take a break if you don't think it's going somewhere. Reassess the goals with the therapist, and to see, and they might even, I've had therapists who say, look, I think we've come to a bit of a stumbling point, maybe we should try something else, or maybe we should bring in one of my colleagues, or so it's really important to keep that discussion open if you find things are stalling. And the other thing sometimes you'll find with children as they get to the teen years, they might develop that bit more of a relationship with their therapist, where they become a bit more friendly rather than therapeutic, and sometimes that step back needs to happen again. And
yeah. So how do you know if you found the right therapist then? Is it just that kind of feeling that, they feel that connection, or what is it?
Yeah, I think, often it's reading the child's comfort. I mean, you will often find that children don't want to engage in therapy, especially as they've been doing it for a while, or their friends and peers aren't doing it. So it's really good, I think, to have a therapist who's quite flexible and open with you and with your child. And if you get that good rapport and discussion, you're probably more than 80% to getting that good therapeutic relationship, when they can have that, oh, I was tired today, so we pulled back and we did this, and they adjust things to teach, to fit in with your child. But if you're getting a very sort of, I suppose, strict, regimented response and reaction, you can often find that doesn't work well with children who've come from a severe trauma background. They do need some flexibility within that process. And I think it's also, depending on their age, it's good to engage the child into the process and seek feedback of it. As I said, you will always get, no, I don't want to go, or I don't want to do this. But when they've had a good achievement and it's come out positive and smiling, you generally know you've got that measure quite right.
Yeah, absolutely. I think for me, it's when they come out and they tell you they feel like they can speak to that person. Yeah. So yeah. I've seen it where it hasn't happened, and then seen it where it has happened. So yeah.
And I think sometimes, particularly if you get a therapist from a multidisciplinary background, like I've had a young person who said to their mum, oh, I'm going to ring such and such and just talk to them. And the person they were talking about was actually their speech pathologist, but he has a background in psychology as well. So it was actually ringing in more just to have a chat. This is a male I can interact with, sort of thing. So
yeah, absolutely.
You can see that they've got that bond, which is just really lovely to see.
Yeah, absolutely. And so I guess flipping that question, what are some of the common challenges or pitfalls that may come our way?
I suppose one of the big ones I mentioned is that overloading. We have a really commonly fall into that mistake of, like, if our child is struggling at school or struggling with anxieties or any kind of things, we just want to wrap them around and try and fix the problems all at once. And I think the biggest problem we fall into is multiple interventions. We want a quick fix often, just as human nature, and we're getting quicker and quicker. I mean, COVID has slowed us down, but I think that's the biggest mistake. Try not to overload your child. They might be diagnosed with a couple of different things, but really prioritise what's important. You'll find children who've had a lot of early childhood trauma are easily fatigued, easily overloaded. They're easily overloaded just with schoolwork sometimes, and that's why we get you get that feedback from school about they're disengaging, or they're not concentrating, or they're having meltdowns and shutdowns, and often that's just because they're so overloaded with the thoughts. So if we add too many layers to that, then you'll find that it starts to cause, I suppose, more issues than it does help.
Yes.
And similarly to making, I suppose, really snap choices on providers, like we said, there can be wait lists, and so you might say, oh well, I'm just going to go with such and such because we've gotten in, but my heart's really with this person. Sometimes it's better to wait and not just go, oh, I can get them in, so I'm going to go with this person, but they might not be that right person, so you're going to have to start the journey again anyway, and then you might have actually put your child off doing speech therapy or OT or any of that. So it's good not to rush, like to take that time, and it can seem really like I'm getting nowhere. So I mean, I remember taking a year to find one particular specialist for my son, and I'm just like, I just want it to start. And but yeah, it's good to take that time, and it's good to have those take the time to do your background, have those questions ready for when you find and open that engagement and session with someone.
Yeah. Great. And is there a kind of guide to what sort of fees you should expect to pay, or contracts you can enter into? Because I've seen everything from a, one visit to commitment to, half a year of visits. So
yeah.
They
do vary a lot. I mean, most of the professional bodies on their websites will have a guideline of what you should expect to pay, and similarly does the NDIS. They have an approved rate. I mean, NDIS has caused its own issue in the fact that certain things have really escalated with SDIS. People have bumped up their charges, but generally across therapies and providers, they will be consistent. So they're a good guideline to go with. Some will do less out of pocket depending on your mental health care plans and on your financial circumstances when you engage with them. I find ones that want to lock you in to be a little bit wary of, unless there's a particular reason. Generally, I'd say have a few sessions and then consider if you're going to lock into a particular time and a session. Some will have like a 10 session to say that they need that to get to a point. And with some assessments and things like that, that will be the case, but just really do your background and make sure that that's happening across the sector, not just in a one-off.
Okay. Do you expect that more with a play therapy versus a psychologist, or is there any kind of guidelines?
Yeah. I mean, depending on what you're wanting out of it, like often if you'll be seeing a psychologist for a multiple of reasons, so to help with educational stuff and with some complexities, they might say, look, we need at least 5 sessions to give you any kind of ballpark of where, and that's probably fairly reasonable. But I would generally say at least that initial information gathering 1 to 2 sessions should be basically all you commit to before you engage for a longer period of time. Sometimes speech pathologists, if they're coming into the school to see your child, or OTs, will want a term commitment. But again, I'd probably recommend that you try and get them to do 1 or 2 sessions to just see if there is that gelling and that bond starting to happen.
Okay. Just on that note of coming into the school environment, how does that work? Are there normally sort of a speech or a paediatrician allocated to a school, or is that a private engagement? How does that work?
It very much varies. That's a really good question. It really varies across schools. Some of the schools will have a speech pathologist who's there a particular type of days, and they generally all will have a psychologist that will come for specific assessments, but they're generally to do with getting funding through schooling arrangements. So I find most people who are using regular speech intervention will have their own speech pathologist who engages with the school a reasonable time to come in, just because it saves the child having to do something else after school. But some schools are really inflexible on that too. So it's really good to have that discussion with your assistant principal is usually the best point of call, and some of the special ed support teachers will often really help and write a recommendation if they think the therapist should come into the school.
I wish I'd thought of that when I engaged with a speech therapist. Damn.
It does make life easier when they can come to school. Although for sure. as they get a bit bigger, the kids don't like to be taken necessarily away from the class and peers. So often having that working relationship, I find our therapists will sometimes engage some of my son's peers in activities as they go to the school. So that's then it becomes a special time where everyone gets to play, a game of Uno at the end of the session or something like that. So it's good to just keep that and if you can weave it into the class teacher as well and have that really open communication, then it can work really well.
Absolutely. Is there anything else you wanted to comment on today before we finish up?
Not really. Just the fact that I would say really use your resources like permanent care and adoptive families, like other groups like that, and getting feedback from them on, like we discussed, probably some more of those alternative therapies, like horse programs, art therapies, your play therapies. And there will be some rogue ones out there, so do your research. But you'll find, particularly with younger children, or particularly with the preteens, where they're really not into the talking modalities, they really do benefit significantly from those. And I've seen some really wonderful things come out of it, particularly the horse programs, and music therapy is another really good one.
Yes, absolutely. Yeah, it's something I'm interested in, is learning more about nature therapy. So, it's probably considered a rogue one, but I can see there might be some advantages to being out in nature when you're trying to unpack some things. So
and a lot of those school holiday programs that work specifically focused on traumatized youth and adolescents will use that nature connection quite strongly.
Yeah, for sure. So, well, thank you so much for making time today. I really appreciate it. It's going to really help our carers get started with the process of knowing who to contact and making it happen for their children. So thank you so much. And thanks to anyone else that's making the time to listen to this recording. Thank you.
Bye.